नमस्ते बिटिया, हमेशा खुश रहो बिटिया। My name is Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI Vidyapeeth, Women's University, Jaipur. Today's topic is viral hepatitis. The term viral hepatitis is used to describe infections of the liver caused by hepatotropic viruses. Currently, there are five main varieties of these viruses causing distinct type of viral hepatitis. First is hepatitis A virus causing a fecally spread self-limiting disease. Second is hepatitis B virus or HBV causing a parenterally transmitted disease that may become chronic. Hepatitis C virus or HCV, previously termed non-A or non-B hepatitis virus, involved chiefly in transfusion related hepatitis. Hepatitis delta virus HDV, which is sometimes associated as superinfection with hepatitis B infection. Hepatitis E virus or HEV causing waterborne infections. Though a number of other viral diseases such as infection with Epstein-Barr virus in infectious mononucleosis or arbovirus in yellow fever, cytomegalovirus, herpes simplex, and several other affects the liver, but the changes produced by them are non-specific. The term viral hepatitis is strictly applied to infection of the virus by hepatitis virus. Etiological classification. Based on the etiological agents, viral hepatitis is currently classified into five etiological types: hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. There are some difference between all of these five type of virus. Source of virus. The source of type A virus is feces. Type B virus is blood and body fluids. Type C hepatitis virus is also spread by blood and body fluids. Type D is also with blood and body fluids, and type E is with feces. Route of transmission. Type A is transmitted by fecal-oral route. Type B is f- transmitted by childbirth or by needles or by sex or by transfusion. Type C is also transmitted by childbirth, needles, sex, or transfusion. Type D is also transmitted by needles, sex, transfusion. It also required hepatitis B infection. Type E is transmitted by fecal-oral route. Now, chronic infection. Type A does not have any chronic infection. Type B have chronic infection. Type C have chronic infection. Type D have chronic infection, while type E does not have any chronic infection. Prevention. Type A is prevented by vaccination. Type B is also prevented by vaccination. Type C is prevented by blood donor screening, risk management, and educations. Type D is prevented by vaccine. Type E is prevented by ensured safe drinking water. Now, hepatitis A virus. The etiological agent for hepatitis A or HAV is a small 27 nanometer diameter ecoshedral non-enveloped single-stranded RNA virus. Viral genome has been characterized, but only a single serotype has been identified. HAV infection can be transmitted to primates and the virus can be cultivated in vitro. Pathogenesis. Hepatitis A virus is presented in the liver and replicate there. It is present in the liver, bile, blood, and stools in the pre-icteric incubation period, but viremia and viral shedding in stool is diminished after jaundice appears. Evidence that hepatitis caused by HAV has an immunological basis comes from demonstration of following antibodies acting as a serum markers for hepatitis A infection. Immunoglobulin M anti-HAV antibody and immunoglobulin G anti-HAV antibody. Hepatitis B virus HBV. The etiological agent for hepatitis B or HBV virus is a DNA virus which has been extensively studied. Electron microscopic studies on serum of patient infected with HBV shows three forms of viral particles of two sizes, either small sphere or tubule filaments and large spheres. The genomic structure of HBV is quite compact and complex. The HBV DNA consists of four overlapping genes which encode for multiple proteins: S gene, P gene, X gene, and C gene. Pathogenesis of hepatitis B virus. There is strong evidence linking immune pathogenesis with hepatocellular damages. First is, since a carrier state of hepatitis B without hepatocellular damage exists, it means that HBV is not directly cytopathic. Second is, it has been observed that individuals with defect or deficiency of cellular immunity have more persistent hepatitis B disease instead of clearing HPV from their blood. In support of cell-mediated mechanism in hepatocellular damage by HBV comes from observation that viral antigen are attacked by host cytotoxic CD plus T lymphocytes. The host response of CD plus T lymphocytes by elaboration of antiviral cytokines is variable in different individuals, and that determines whether an HBV infected person recovers, develops mild or severe disease, or progress to chronic disease. Serological and viral markers in support of immune pathogenesis is the demonstration of several immunological markers in the serum and in hepatocyte indicative of presence of HBV infection. These are as under: HBsAg, anti-HBs, HBeAg, anti-HBe, HBcAg, anti-HBc, and HBV DNA. Hepatitis D. Infection with Delta virus is in the hepatocyte nuclei of HBsAg positive patients in termed hepatitis D. HDV is a defective virus for which hepatitis BV is the helper. Thus, hepatitis D develops when there is concomitant hepatitis B infection. With co-infection, acute hepatitis D may range from mild to fulminant hepatitis, but fulminant hepatitis is more likely in such a simultaneous delta infection. Chronicity rarely develops in the co-infection. With superinfection, incubation period 30 to 35 days. Chronic HBV infection get worsened indicated by appearance of several and fulminant acute attacks, progression of carrier stage to chronic delta hepatitis, or acceleration towards cirrhosis. Occurrence of hepatocellular carcinoma is, however, less common in HBsAg carrier with HDV infections. Pathogenesis. HDVs, unlike HBV, is thought to cause direct cytopathic effect on hepatocytes. However, there are examples of transmission of HDV infection from individuals who themselves have not suffered from any attack of hepatitis, suggesting that it may be always cytopathic. It may not be always cytopathic. Hepatitis C. The diagnosis of this major category of the hepatitis was earlier made after exclusion of infection with other known hepatitis virus in those time and was initially designated non-A non-B hepatitis. However, now it has been characterized and is called hepatitis C. Pathogenesis of hepatitis C. In HCV-induced hepatocellular injury by cell-mediated immune mechanism is supported by the following. It is possible that the host lymphoid cells are infected by HCV virus. HCV activated CD40 plus helper T lymphocyte stimulate CD8 plus T lymphocyte via cytokines elaborated by CD4 T helper cells. The stimulated CD plus T lymphocyte in turn elaborated antiviral cytokines against various HCV antigens. Further support to this T cell mediated mechanism comes from the observation that immune response is stronger in those HCV infected persons who recover than those who harbors chronic HCV infections. There is some role of certain HLA alleles and innate immunity in rendering variable response by different hosts to HCV infections. Natural killer cells also seems to contribute to containment of HCV infection. In as subset of patients, there is cross-reactivity between viral antigen of HCV and host autoantibodies to liver, kidney microsomal antigen, which explain the association of autoimmune hepatitis and HCV hepatitis. Hepatitis E. Hepatitis E is an enterically transmitted virus previously labeled as epidemic or enterically transmitted variant of non-A non-B hepatitis. The infection is generally acquired by contamination of water supplies such as after monsoon flooding. HEV infection has a particularly high mortality in pregnant women but is otherwise a self-limiting disease and not has not been associated with chronic liver disease. Incubation period. It varies among different hepatotropic viruses. For hepatitis A, it is about 4 weeks. For hepatitis B, it is about 10 weeks. For hepatitis D, it's about 6 weeks. For hepatitis C, it's about 7 weeks. And for hepatitis E, it's about 2 to 8 weeks. The patient remains asymptomatic during incubation period, but the infectivity is highest during the last days of incubation period. Morphological features. Grossly, the liver is slightly enlarged, soft, and greenish. Histologically, the changes are as follows: hepatocellular injury, inflammatory infiltrates, Kupffer cell hyperplasia, colic and regeneration. Viral hepatitis is an infection of the liver caused by hepatotropic virus A, B, C, D, and E. Hepatitis A is fecally spread and self-limiting disease. Early immunoglobulin M and later immunoglobulin G antibodies appear in the blood. Hepatitis B is transmitted parenterally through blood and blood products. There are several immunological markers in the serum HBs, AG, anti-HBs, etc. Hepatitis D develops with hepatitis B either as co-infection or may be infected as superinfection. Hepatitis C infection is acquired by blood transfusion. Hepatitis E is an entirely transmitted infection. Carrier state exists for hepatitis B and C only. Morphological of acute and fulminant hepatitis caused by different hepatotropic viruses is similar. Chronic hepatitis may occur in infection with hepatitis B, C, and combined HBV and HDV. Immunoprophylaxis by few hepatitis vaccine is done for high risk population. This session is powered by digital version 2.0 Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in the comment box. Thank you.